I do worry about this tremendously. People who don't fit the assay, a genetic test. We think we have problems communicating now to patients, but how are we going to tell a patient that they are, quotes, the wrong profile? We're not going to use the word wrong, but we do need to learn how to talk to patients in a new way when we use personalized medicine. Secondly, we have to ensure that there are trials for the haves and have-nots, because otherwise we are going to forget about a whole group of people who desperately need treatments and through no fault of their own just don't fit the current requirements. And finally, I think we need to concentrate on companion diagnostics to make sure that they are absolutely validated from country to country, they're repeatable, they're 100% accurate, because my greatest fear is that you will have patients who will be left out of a treatment which could benefit them. Absolutely. And I think this is very important, these 3 points to keep in mind.
It's absolutely true. I mean, the issue of accuracy in molecular testing is very much critical. I already had experience, for example, in melanoma patient having BRAF with clinical trials with centralized molecular testing. I had a couple of patients that they were excluded from the clinical trial just because the centralized center didn't perform properly the test. So this is one of the other issues that you may help us in bringing to the attention of people.
Adequate testing is very important, especially if the drugs are already on the market. It is even more important than in experimental drugs in a clinical trial system. I would like just to give you the experience we had in Italy, and was a very good experience started 4 or 5 years ago between a collaboration established with IOM, the Italian Society of Medical Oncologists, and CAPEC Society, where Dr. Dei Tos works, so the pathologist and molecular pathologist. And so what we did was exactly the same, try to find a network of centers that were able to learn how to do the genetic testing for the drugs that were on the market or were reaching the market. And so we have done a network with qualified centers that have done qualified controls of quality, and this is now reproducible for HER2, for EGFR mutation, for KRAS, for BRAF, and now I guess also for ALK4. And so this is ongoing, yeah. So this has been the approach that has been done completely independent from the public health system in Italy, I'm sorry to say, and this was done by the professional societies that were working together to fulfill a need that the public health service completely still ignores.